Welcome to U.S. Naval Hospital, Naples, Italy. As a licensed independent provider in a small command with only 2 pharmacists, you may be called upon to perform final prescription verification after hours or on the weekends. In order to help you with this, we have prepared a licensed independent provider checklist. Now let's review some scenarios that demonstrate the most critical elements of outpatient prescription verification.
In our first scenario, the LIP is performing final verification on a pediatric antibiotic prescription. Critical elements to note in this verification include a handwritten DD 1289 script, the requirement for product reconstitution, and the use of auxiliary labeling to ensure proper storage and beyond use dating.
Hey, H3 Clinic. Good morning.
Hello,
hey,
sir.
Thanks for coming up to the pharmacy. I understand we have 3 prescriptions we have to verify today. Is that correct?
Yes, sir.
Great, and we're going to utilize our checklist.
Yes, sir.
Great.
So the first patient we have is Tess Child, and if you could verify that the patient's full name and date of birth are correct.
The first step in prescription verification is to ensure that the patient has been identified using 2 unique identifiers, full name and date of birth.
Okay. Tess Child, date of birth, 29 March 2010. That would be correct.
Okay, after that we need to verify the information on the prescription label is clear, concise, and appropriate, and that we have the correct medication, strength, and quantity.
Okay, it'd be amoxicillin, oral suspension, 400 milligrams per 5 cc's.
Okay.
And the dose, as we have, would be 12 million units POBID. Concur?
Yes, sir. Now we have to verify that there are appropriate auxiliary labels on it. So according to the bottle, we need to keep in the refrigerator. There's an expiration date on it, 14 days out.
I see that.
And the patient is instructed to shake well before using.
And do not freeze.
Yes, sir.
Okay.
The second step is to verify that the prescription is labeled correctly. This includes verifying that the name, strength, and quantity are correct, that the directions for use are clear, that appropriate auxiliary labels are included, such as storage requirements, special directions, and expiration date. If the prescription is handwritten, the LIP must ensure that the label reflects the written order to avoid any transcription error.
After that, we need to verify the medication is accurate.
Medication accuracy can be verified using a drug source bottle or an electronic drug identification program such as Lexicomp, which is available from our intranet homepage.
So this prescription is written for amoxicillin 400 milligrams per 5 ml. We have amoxicillin 400 milligrams per 5 ml. That's correct.
Okay.
After that, we need to verify that the medication is reconstituted. So here we need a total of 68 ml to reconstitute it with, and that yields a total of 100 ml after reconstituted. So we have a total of 300 ml here,
okay.
And the quantity is written for 240, so it's appropriate amount to give to the patient.
Check.
Medications should always be dispensed in a ready-to-administer form. Also, the patient should leave the facility with an appropriate quantity of drug that covers the duration of prescribed therapy.
Verified.
Okay, after that, we need to verify the appropriateness of the medication type and dose against the patient's weight and age.
Okay. Patient weighs 22 kilos, and we have amoxicillin 400 milligrams per 5 cc's. Divided by 5. Times 12 milliliters times 2 divided by 22, and that equals approximately 90. And that's the verification of our dose. And so it'd be 90 milligrams per kilo per day divided Q12 hours. So verified.
Okay, so it's an appropriate dose.
In addition to verifying appropriateness of the medication dose against the patient's weight and age, other factors to consider include renal or liver function, other medications the patient may be taking, and other disease states that may be present. For all patients 12 and younger, the weight and dosing should be documented in the comment field.
Now, I just need you to sign, print your name, and date it.
The final step is documentation.
Anywhere on the slip, and this lets the pharmacist know that you verified the prescription as correct.
Okay.
In our second scenario, the LIP will be checking discharge medications for an adult patient, including a Schedule II controlled substance.
Okay, so the next prescription's for patient Abby Test. If you could verify their full name and date of birth.
Okay, the patient would be Abby Test with a date of birth 1 January 1963.
Okay, now we need to verify the medication name, strength, quantity.
Okay, and the medicine would be Ducosate sodium, and take 1 capsule by mouth twice a day as needed for constipation. That would be correct.
Okay, directions are clear. And now I haven't given you a stock bottle for this because this comes out of our Parata Max machine.
And what's a Parata-Max?
The Parata Max is an automated pill dispensing system which is verified by our pharmacist whenever medications are filled into it. So it doesn't need a stock bottle for you to verify because it's already been verified by the pharmacist.
Okay, correct. Check. Yeah, this is not a controlled substance.
Correct, sir.
Okay, and does not require any reconstitution. It's as is. Great. And this patient going down a checklist is, this is appropriate for the age. This is not a child less than 12.
Right.
And so our last HM3 is documentation complete, verification by signing our form here. So I verified, and today's date, signature, and then my printed name.
All right, sir.
Agree?
Yes, sir.
And then our third medication today would again be for the same patient, correct? If you go ahead.
Yes, sir. Patient's full name and date of birth.
Abby Test, and date of birth would be 01 January 1963.
Okay, now we have to verify that the medication name, strength, and quantity is correct.
So it'd be Percocet, 1 to 2 tablets by mouth every 4 hours.
Okay, if you could verify that the medication in the stock bottle here is the same as the medication in the vial.
Okay. That would be verified.
Okay. Okay, sir, because this is a Schedule II drug, we have to double count it.
The LIP must double count all Schedule II controlled substances to verify that the correct quantity is being dispensed.
Okay, and our total count today would be 50, correct?
Yes, sir.
Off our bottle. That would be 50.
Okay, so the count is correct.
That's correct.
Now we need to verify that the medication type is appropriate according to the patient's weight and age.
It is. This is an adult. This is the appropriate dose.
Okay. If you believe that everything is correct, I need you to sign, date, and print your name.
Good to go, HM3?
Yes, sir.
Appreciate your help. Thank you.
No problem.
The verification checklist will be available in the pharmacy, on the MSW, and in the emergency department. By using the verification checklist, you will be prepared to safely dispense prescriptions after hours.